May is Maternal Health Awareness Month, a time to shine a light on the health and well-being of mothers before, during, and after pregnancy. With Hartford Healthcare leading the charge, we are taking a closer look this morning at how expectant mothers can receive the support they need for a healthy pregnancy and beyond. Joining us to tell us more is Dr. Dalianne Hemmings, System Director of Maternal Health Equity at Hartford Healthcare. Doctor, nice to be with you this morning.
Nice to be with you too. Thank you.
Of course. I love that we are really putting a focus on the well-being of women before pregnancy, during, and after. How does Hartford Healthcare really support mothers during this time?
Well, some of the information that is provided to mothers is just education, right? Providing education on what are some of the things that patients need to look out for, and who to go to when they have those questions, and also conducting screening. It's important that we understand where patients are and what their experience is, how that's impacting them, and also connecting them with different organizations like different support groups, such as Postpartum Support International.
Oh, that's wonderful. And I am an expectant mother myself. And so often I'm asked, how do you feel? And it's such a warming, heartwarming question for people to really care about how you're doing. But often we just associate that with the physical part of us. How are we feeling physically? But mental health is such an important part of pregnancy as well.
That is so true. Well, let me say congratulations.
Thank
It
you.
is so important, especially because mental health is one of the leading cause of death related to pregnancy, right? So it's important for people to understand that sharing how they're feeling and the experiences that they're having, that they bring them to their providers as soon as possible. One of the things that people also don't know is that if you have a history of depression, it's possible that you can have an increased risk of postpartum depression. So that information should be shared so that people are talking about this early in their pregnancy and not waiting until they really don't feel well.
Absolutely. And often, women may say it's just my hormones speaking. But how can a woman really tell if they are struggling with anxiety or depression during their pregnancy?
Yeah, it's very possible that they may not feel like doing the things that they usually enjoy, right? They have a hard time even getting out of bed. They have difficulty caring for themselves or their babies. And in some cases, they even feel like they may harm themselves or their babies. Sometimes what happens is patients take themselves off of medication, and they do it because they're trying to protect their unborn baby. They figure the medication may not be good, and so they take themselves off, but not all medication is meant to be stopped abruptly. And so if you're not doing that with a doctor's support, it can be something that could be difficult for someone to work through. So we definitely encourage that instead of just stopping the medication, if someone is on medicine, that they speak to their doctors about that when they become pregnant.
Yeah, having a nice relationship with your providers is so important during such an important time.
Indeed. It really is important. And it's important for, a person to can seek care in
Mhm.
speaking with someone if that's important. Because in addition to medication, of course, for some people, there's the therapeutic piece of actually having conversations. So whether that's offered in a support group or whether that's offered as therapy that happens on an individual basis, all are important and it's unique to each individual person.
And Hartford Healthcare helps in a lot of ways. We had the website right there on our screen, and we'll have all the info on our website, WTNH.com. Dr. Hemmings, thank you for the time and thank you for the work that you do.